Hello everyone, welcome to Dental Notes and Mnemonics. In today's video, we'll be discussing an essential topic for dental professionals and patients alike, post-extraction bleeding. Understanding what it is and how to manage it can make a huge difference in patient care. First of all, what is exactly is post-extraction bleeding? It refers to bleeding after the tooth extraction that persists longer than normal and may need intervention. This is not just the usual oozing that happens right after the extraction procedure, it's when bleeding becomes a cause of concern. If we define post extraction bleeding, it is defined as the bleeding that continues beyond 8 to 12 hours after the dental extraction. Apart from the time criteria, other three key criteria for identifying post extraction bleeding is a situation where the patient has to seek the emergency help. Second is development of a large hematoma or ecchymosis in the oral tissues, and when the blood transfusion or the hospital care becomes necessary. In any of these cases, we may classify it as post extraction bleeding. Diving deep into the post extraction bleeding, we should have an idea about how the bleeding stops after extraction. So hemostasis is the process the body uses to stop bleeding and form a stable blood clot after injury, which is in the extraction socket. It involves three main steps. First step is vasoconstriction. Due to vasospasm, blood vessels they narrow immediately after extraction to reduce the blood flow. It is very important to minimize the blood loss and create the first line of defense against the excessive bleeding. Second, there is a formation of platelet plug. Platelet stick to injured side and to each other. Key steps during this process is first of all adhesion. Platelets attach to the exposed collagen at the injury site. In the second step, these change their shape and release the chemicals like ADP or thromboxane A2 to recruit more or attract more platelets. And final stage is aggregation. Platelets form a temporary plug to cover the injury. So this step is very important as it serves as a temporary barrier to control the bleeding. The first step is known as the primary hemostasis, where there is a formation of the platelet plug. After the formation of the platelet plug, it is termed as the process is termed as a secondary hemostasis, where the platelet plug, which is a temporary plug, it gets converted into the more stable fibrin plug. It is secondary, and tertiary hemostasis is defined when this clot undergoes the remodeling. Formation of platelet plug, it is strengthened by fibrin mesh to form a stable clot, and this procedure is activated by activation of the clotting factors, which are the protein in the blood and triggered in the cascade. Fibrin threads weave through the platelet to stabilize the clot and to ensure the long-term sealing of the blood vessels until healing occurs. Key difference between the temporary plug and the fibrin plug is temporary plug, it forms quickly, whereas the fibrin plug requires time to develop through the clotting cascade. The platelet plug is less stable and can be dislodged easily, while fibrin plug is more stronger and more durable, ensuring the vessel stays sealed. Temporary platelet plug is just like a quick band-aid for immediate bleeding control, while the permanent fibrin plug is a long-lasting solution that secures the wound until tissue repair is complete. Post-extraction bleeding typically looks like controlled oozing or minimal bleeding that gradually slows down and stops within 24 hours. Color of normal post-extraction bleeding is, it is bright red immediately after the extraction, turning to dark red or brownish red as the blood clots. A small amount of the blood is mixed with saliva is normal and may appear as more than it actually is due to the dilution with saliva. Within the first hour or the two, a blood clot forms at the extraction site. This clot is dark red and serves as a first step in healing. Minimal oozing may persist for 6 to 12 hours, but active bleeding should stop relatively quickly with proper care, such as biting on gauze. There should not be active bleeding that saturates gauze within a few minutes or requires frequent replacements. If bleeding exceeds this description or it is accompanied by pain, swelling, or other unusual symptoms, it might indicate a complication such as delayed healing or a disturbance in the clot. Post-extraction bleeding can be categorized into three main types. First is primary, second is reactionary, and last is secondary bleeding. Each type occurs at the different types and it is influenced by different factors. Talk about the primary bleeding. Primary bleeding occurs immediately during the extraction process. It's a natural bleeding that happens as a tooth is removed and blood vessels are cut. However, this bleeding typically stops once a clot forms at the extraction site. This is a normal part of the healing process as the body works to heal the wound and prevent further blood loss. Reactionary bleeding happens a few hours after the extraction, usually within first 6 hours. This type of bleeding occurs when the initial clot becomes disrupted or if there is spasm in the local blood vessels, causing them to open up again. While it's not as common as primary bleeding, it may happen due to patient movement, physical activity, or pressure changes at the site. Secondary bleeding typically arises 24 to 48 hours after the extraction or even later. It is often caused by factors such as infection at the extraction site, which can break down the clot and disrupt the healing process. Systemic factors like underlying medical conditions or medications can also contribute to secondary bleeding by affecting the body's ability to form or maintain a clot. The basis of severity of bleeding, it may be categorized into three categories: mild, moderate, and severe. Mild means oozing, where the moderate means persistent bleeding on the second day, and if the patient requires hospitalization or advanced intervention, that comes into the category of severe bleeding. Extraction bleeding can occur due to a variety of local and systemic factors which can affect the body's ability to control bleeding. Following a dental procedure, let's break it down into the two categories: local and systemic. Local factors involves the injury to the blood vessels during the extraction. If the surgical technique is not optimal, sometimes the extraction can cause a fracture of the alveolar bone, which can damage surrounding blood vessels, contributing to the bleeding. Infection at the extraction site can also affect the healing process and promote continued bleeding. Factors include conditions like hemophilia or von Willebrand disease, which affect the blood clotting. Certain medications such as anticoagulant and antiplatelet prevents blood clotting. The liver also plays an important role in producing clotting factors. So in the patients with the liver diseases, the production of these factors is impaired, which increases the likelihood of bleeding. High blood pressure can also cause the damage to blood vessels, making them more prone to rupture. In dental extraction, uncontrolled hypertension can lead to more significant bleeding than expected. Before going into the management part of post-extraction bleeding, let's discuss how to prevent the post-extraction bleeding. Prevention is always better than cure than managing the complications later. Pre-operative prevention includes a risk assessment of the patient. Ask the patient about any health problem, bleeding disorders like hemophilia or liver diseases. Check for the medications they are taking. They might be on blood thinners like warfarin or aspirin, increasing the bleeding risk, or other medications like steroid, which may delay the healing after the tooth extraction. Don't forget to ask about the allergies to medications or material used in the dental procedures. Sometimes we may be needing laboratory tests also. If the patient has the history of the bleeding problems or is on anticoagulant, then we have to go for laboratory test. The key tests to check blood clotting are: prothrombin type shows how long it takes a blood to clot. International normalized ratio helps to monitor anticoagulant therapy, and activated partial prothrombin type test another pathway of clotting. Look for the sign of any local infection like abscesses that may prevent proper clotting. Smoking also affects the healing by reducing blood flow, and alcohol can thin the blood, making it harder to stop bleeding. Intraoperatively, during the procedure, handle the tissues carefully, avoid excessive trauma to gums or bones, use proper surgical techniques such as clean incisions and remove sharp bone edges. Place sutures if needed to stabilize the blood clot and close the wound. In certain cases, additional support might be needed to stop the bleeding. This can include the application of hemostatic agents such as gel foam or collagen sponges, which encourage clot formation. For the patient with a higher risk factors for bleeding, antifibrinolytic medications like tranexamic acid may be prescribed to help the clotting process. In postoperative care, instruct the patient to bite down on the clean gauze pad for 30 to 60 minutes to apply pressure. Patients should be advised not to spit, rinse, or use straw for at least 24 hours. Suggestion of eating soft foods and avoiding hot and hard food should be given to the patient. Also advise the patient to stop smoking or alcohol intake at least for 48 hours after extraction of the tooth. Lastly, a follow-up visit is critical. Schedule a checkup within 24 to 48 hours to ensure that there is no delayed bleeding or other complication. It's important to monitor the healing process and address any issues promptly. Now we will discuss about the post-extraction bleeding and its management. First of all, assess the bleeding. When managing a post-extraction bleeding, it is essential to differentiate between normal oozing and active bleeding, as it helps to determine the severity of the situation and required intervention as well. Normal oozing is a mild, continuous discharge of blood that mixes with saliva. It is pink tinged saliva, not bright red color, and it is expected in the first 24 hours after the tooth extraction. So for this, we have to instruct the patient to bite on gauge for 30 minutes, avoid spitting or using straws, as these actions disrupt the clot formation, and the patient should be advised to ensure adequate rest. Now, the active bleeding is persistent or profuse bleeding that does not reduce after 20 to 30 minutes of direct pressure. It appears bright red in color and often pooling in the mouth or dripping consistently. So next step after the assessment is, if the bleeding is active, apply a firm pressure with a gauge, use local measures like hemostatic agents, sutures, or adrenaline, and investigate for systemic causes if the local measure fails. If the bleeding stops, continue with the aftercare instructions, reinforcing the instructions and emphasizing a soft diet and avoiding heat or alcohol. The interventions for controlling the post-extraction bleeding can be categorized into two groups. First is the local intervention and the systemic intervention. Local interventions are targeted at controlling the bleeding directly at the extraction site. This includes the hemostatic agents like gelatin sponge, oxidized cellulose, or fibrin glue. The mechanism of action of local intervention is hemostatic agent absorb blood, creating a scaffold that facilitate platelet aggregation. They enhance fibrin formation and stabilize the clot. It is placed directly into the bleeding socket and compressed with a gauge for 10 minutes. Second intervention is the use of the sutures. Sutures physically close the wound ends, reduces the surface area exposed to bleeding. It stabilizes the blood clot as well and prevent mechanical dislodgement. For effective stabilization, use figure of 8 sutures. Local anesthetic with adrenaline at a very high dilution can be used as a local intervention. Adrenaline causes a vasoconstriction, reducing the blood flow to the area, decreases bleeding, and provides a dry surgical area. It may be administered as nerve block or infiltration near the socket. Cauterization uses heat or chemicals to seal the bleeding vessels. They prevent further blood loss by forming protein coagulum. If the local measures fail, especially in cases with the systemic bleeding disorders, then we have to opt for the systemic interventions to control the bleeding. Tranexamic acid in the form of the mouth rinse 5% or intravenous should be used. Its mechanism of action is to inhibit the plasminogen activation, preventing the breakdown of the fibrin clot. Thus, it has an antifibrinolytic activity. Soak the gauge in tranexamic acid and placed it over the socket. Is vitamin K. Mechanism of action of vitamin K is it helps to synthesize clotting factors 2, 7, 9 and 10 in the liver. It is effective in the patients on anticoagulants or with vitamin K deficiency. It is administered orally or via injections under medical supervision only. Third is desmopressin. Its mechanism of action is that it releases the von Willebrand factor and factor 8, enhancing the platelet adhesion. It is used in patients with the bleeding disorders like hemophilia A and von Willebrand factors. It is used in the patient with bleeding disorders like hemophilia A or von Willebrand disease. It is administered intravenously or intranasally. The last intervention is fresh frozen plasma. It provides deficient clotting factor for the patient with a severe coagulopathies. Refractory bleeding refers to the persistent or recurring bleeding from an extraction site despite applying standard first aid measures like gauge application. For advanced care, if the bleeding still persists or it is recurrent, then the patient should be referred to the higher center. Always start with the local measure first. Apply pressure with the hemostatic agents like oxidized cellulose. If bleeding persists, proceed with the sutures and local anesthetics. After that, move to the systemic measures. If the bleeding source is systemic, the patient might be on anticoagulant therapy. Administer tranexamic acid or the vitamin K. So this was all about post-extraction bleeding and its management. Thanks for watching the video. If you found this content helpful, please consider liking, sharing and subscribing to the channel for more insightful videos. Your feedback and questions are always welcome. Please feel free to leave them in the comment section below and I'll do my best to respond. Thank you for your time and I look forward to bringing you more valuable content in the future. Till then, bye bye, take care. See you in the next video. Have a nice day.